Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to do another mind map. I've been doing lots of these mind maps, less than 5 minutes to cover a topic which is amazing for nursing students, or if you're just getting out into the field. It's a simple way of reviewing a topic. So let's get started. So croup. What is croup? So it's a childhood condition that affects the windpipe. So this is the trachea and the airway to the lungs, the bronchi, and it also affects the voice box, so the larynx. Now, what are the signs and symptoms? So what are you going to see with a patient that has croup? You're going to hear a bark-like cough, okay? It's quite loud, and it does kind of sound like a seal. Now, they will have a hoarse or croaky voice. They'll have difficulty breathing, harsh grating sound when they're breathing. So this is called stridor, and the symptoms tend to be worse at night. Now, how is croup diagnosed? So really, your general practitioner will do their assessment and make their diagnosis off that. They also use temperature and pulse oximetry, because this is a virus, okay? So it is a virus, so a lot of times they'll have a high fever, and with the pulse oximetry, because it's affecting their airways, they're having difficulty breathing, their oxygen level can be lower. So as I just said, what is the cause? So the cause is a virus, and it can actually be multiple different viruses that cause croup, but the most common is the para-influenza virus. Now let's have a look at treatment. So treatment really depends on the severity. So if we're treating at home or treating in hospital. If the patient's in hospital, it is a more severe case. So let's look at the home remedies first. So we'll use medication to reduce pain and fever, give plenty of fluids. A doctor sometimes does order a corticosteroid, and it'll just be a single dose to give at home. Now in hospital, if the patient is having problems breathing or shortness of breath, they can give a nebulizer with adrenaline in it, and they'll also use oxygen therapy, and they just put that in the little nasal cannula, or sometimes they use a little mask for children. Now, I do just want to note here in the top corner in red here, complications. So there can be severe complications to croup, such as respiratory distress, respiratory arrest, and secondary infection. So I hope this mind map did give you a better idea of what croup is, the signs and symptoms, and how we treat it. But that's all I have for this video, guys. I hope to catch you in my next one. Bye for now.